I want to ask, Rissa, do you remember Bernie and Caricchio?
Yes, these are some of the lupus doctors.
Yeah, but I had it bad too, right?
Yes.
And I was in a
You're a lot better now.
yeah, in a 100 medication in the 3-day coma. Remember that?
Yeah, you're doing much better. God bless.
Another question then.
I had a doctor ask me when I called, it was after hours, and they asked me, well, why didn't you call during clinic hours? I said, well, my lupus doesn't know. It's after 5 p.m. But can you help me now? And I switched doctors. I can't do it.
Yeah, honestly, it's not easy for you. It's not. And it won't be moving forward either. But be persistent, be your best advocate. But please avoid the ER. Those doctors, they are not a good service to you for your lupus flare-ups, honestly, unless it's something like threatening.
Okay, there's a question.
Yes. My name is Deborah Paris. I've been living with lupus for over 38 years. Wow. And one of my physicians was Dr. D. Horatius, who has since passed away. He's one of the best in the city for a long time.
He passed.
So my question is this. I was told years ago never to take a live vaccine because it would trigger a lupus flare-up.
Yes.
Now, I traveled a lot for my job because I'm a clinical scientist. And the only place that I was not able to travel to was certain parts of Africa because it required you to take the yellow fever vaccine. Now, my question is it still true not to take a live vaccine? I need to get to Africa, but I do not want to get sick. I have not been sick since 1997.
Ron, do you want to take it?
Thank you for the question. That's actually a great question to ask. And you're right. As lupus patients, you are counseled to avoid those live vaccines. Now, in this case where you needed that yellow fever vaccine, that's where it's great to talk to your pharmacist or talk to your doctor to look at, what are your medications? What are you taking? What's the best way that we can fit this vaccination into your schedule so that you experience limited interactions? So that's, there are some live vaccines where it is necessary, and that's where you're, talking to your doctor and your pharmacist, you're able to weigh those risk benefits.
So I was told that maybe in order to take it a month before I leave, maybe take it about 4 or 5 months before I leave. Is that good advice or no?
Well, that is a great question, but I would have to look at your case, just to see, what all you're taking, your medication history, to be able to give you a more tailored response to that. But I'm open to follow up with you after the panel. But
okay.
If it's okay, before taking the next question, I want to go to Dr. Call, because there are new guidelines in treating lupus nephritis, and they are more, let's call them, forward compared to the other ones. Can you tell us a little bit about that?
Yeah, so because kidney is like one of the most common organs that's involved for lupus patients, and it's a big cause of morbidity and mortality. Patients requiring dialysis if they experience progressive renal kidney failure. So yeah, for a long time, I think with lupus nephritis, we also kind of were limited with using a few tools that we had. Some of those medications, including maybe some people are familiar here with cyclophosphamide, and depending on, because lupus in the kidney is a very variable disease. Every patient is actually very different, and every person's biopsy can look very different. And but lately, what I'm actually really happy about is that we have started to move away a lot from using cyclophosphamide because a lot of my patients with lupus-related kidney disease tend to be young adults of childbearing age, and fertility side effects are very concerning with using cyclophosphamide. So one of our big developments has been something called using a multi-target approach, because one of my mentors taught me that lupus in the kidney was essentially like your body is rejecting your own kidney. It thinks of your kidney as someone else's, and so we kind of have changed our approach to treating lupus in the kidney, same as we would treat someone with a kidney transplant, and use a very similar multiple target based regimen, which allows us to use less doses of certain medications. It allows us to use less steroids, which is also very important for patients to be on less steroids. So I'm very excited about that ability to have that option, especially for young patients where their kidney biopsies seem feasible for this multi-target approach, allowing me to use as little steroid as possible, allowing me to use less mycophenolate than we would use previously. Having said that, we do have other, what are called biologicals for lupus nephritis, and most of them, suppress your immune system in one way or the other. But I do think that, we have other things besides cyclophosphamide, which is a very strong immunosuppressant, kind of blanket suppresses your immune system, and although we have the most experience with cyclophosphamide because it's been around since 1950s, I think, and but I'm excited that the multiple target based regimens, we do have more longer term data on that, and they seem to be more effective for lupus related kidney disease in patients, and that's been, I think, one of the biggest advancements as far as lupus nephritis is concerned. And even with the best of care before this, the remission rates, which is the rates at which people go into remissions, hasn't been very good for lupus nephritis. So yes, very exciting, I guess.
So I have a question. So you said you're going to multi treatments for people with lupus and lupus nephritis. So I had a transplant, and of course I have lupus as well. So lupus causes kidneys to fail. So what are some of the recommendations or other treatments besides taking Salsep, tacrolimus, and prednisone?
So for a patient like yourself that has already been transplanted, so lupus nephritis in a transplanted kidney does not tend to recur as much. And even though your transplanted kidney may show some microscopic features of lupus, the recurrence in a transplanted kidney is very low. So your regimen is not so much geared towards lupus nephritis, but more towards anti-rejection for your transplanted kidney. But if you look at the regimen for yourself, it would include something like tacrolimus or Prograf with mycophenolate and steroid. And if you were a pre-transplant lupus nephritis patient, that is a very similar regimen we use for lupus nephritis now. We use mycophenolate, steroids, and not tacrolimus, but something called voclosporin, which is a very similar medication to tacrolimus. So your regimen is more it's more geared towards preventing rejection and not so much treating lupus because you're already transplanted. Okay, and lady in the back.
My name is Diane Kira, and
I was just diagnosed this year. I am 88 years old. They said this is for young people. Here too. They said it's not right. But anyway, I am on Cephalilla. I've had 4 infusions so far. I only have 1 kidney. I had 1 kidney taken out because of cancer. Now, is this Sapinello. I've had 4 infusions, I get another one Tuesday. And to tell you the truth, it's the first time I've taken it, and I don't know if it's helping. And I don't want it to hurt my kidney. And since I've been on this, talking to a doctor I found is very hard. They don't give you answers. You're not allowed to ask. You can't even ask in the office.
Yeah.
And my question to you is this Sapinello going to make me better because 4 infusions? I don't feel any different. And every time I ask a question, I'll even call the Sapinello people, AstraZeneca. I get no answers. They tell me to ask my doctor. Now, if I don't see my doctor for 4 months, how am I going to ask him? And this is what I say. I bought 2 big books on lupus. And the first thing they tell you is to sit down with your doctor, tell him your problems, and let him answer. But if he doesn't book you till every 4 months, how are you going to talk to him?
Dr. Long, you want to take that?
But is Sapinello going to hurt my one kidney?
Okay, so first I will say that how you mentioned that, how do you talk to your doctor when your doctor's not there? And this is where I would,